Hello, welcome back to the Harmony Inspired Health podcast. Today's episode is for every woman who's ever wondered, why am I doing all the right things but still feel exhausted, foggy, and stuck with stubborn weight? My guest today is Dr. Aleksandra Gajer, a high-level physician who is changing the game in precision and performance medicine. She's the founder of the Gajer Practice, where she specializes in hormone optimization, metabolic repair, and peptide therapy for peak performance. Dr. Gajer works with high achieving women who've mastered their careers but want to reclaim their bodies so they can feel energized, focused, and truly at home in their own skin again. So, in this conversation, we're going to decode the hidden hormone metabolism connection, what performance medicine really looks like in daily life, and how to build a future proof plan for long term health without chasing quick fixes or trendy biohacks. Welcome to the podcast, Aleksandra, or Dr. Aleksandra.
Thank you so much. Thank you for that lovely intro.
It's so exciting to have you here. Like, this topic is right up my alley. I'm sure I'm going to be learning a lot from you myself. And so I'm going to be jumping straight into the conversation, but I want to start with the basics. How are our hormones and metabolism actually connected?
Yes, that's a great question. So, when I treat women, I think that metabolism is actually the foundation of our hormone health. And our metabolism, metabolic health, is actually pretty much controlled by our hormones. And we have a number of hormones in our bodies. We often think of hormones and we think about estrogen and progesterone and the sex hormones and the ones that give us the biggest roller coasters that we know of in life. But I think the hormones that govern how we use what we eat as fuel, as we use food as fuel. So when we're eating, our body has a few choices, whether to use the food that we're eating as fuel or to store it, how it's broken down. And a healthy metabolism is really integral to having balanced hormones, especially the hormone insulin. We hear a lot about insulin resistance, and that's sort of an epidemic that we're having now. What's happened with our food supply has caused many women to become insulin resistant and not be able to sort of process insulin or process sugar the way we should, which causes all sorts of downstream issues with all the other hormones, including estrogen, progesterone, thyroid, adrenal glands, growth hormone. There's quite a few hormones and they're all interrelated.
Yeah. And so for our women who are listening, can you explain a little bit about what insulin resistant actually is and how do we get to that point?
Yes. So insulin is the key that opens the doors to your cells for sugar to get in. So sugar, glucose molecules are actually an excellent source of energy. But in most of human history, they were sort of rare. It was rare to find concentrated glucose. So we have this hormone called insulin, which opens the door to the cells to allow that blood sugar to come in. The last 50 years, we've seen foods that have such high concentrations of sugar, whether that's in the form of flour or actual sugar, that the cells have started to say no to the key. The key is no longer fitting in the lock. So basically, our cells are becoming insulin resistant. There's such an overwhelm. And sugar is actually quite toxic and can cause a lot of inflammation. So sugar comes through our gut into our blood vessels, and then it wants to get into the cells. And this key that has historically worked well now is just not fitting in the lock because we're overwhelmed with the amount of sugar and cells are trying to protect themselves. So that's when we develop what's called insulin resistance. And insulin is also a hormone that causes us to store fat. So when we are insulin resistant, most of the time what the body does is it produces more and more insulin because it's not, the key is not fitting in the lock. So maybe we just need more to keep trying. And then your system gets more signals to store the food you eat as fat rather than efficiently use it as energy.
Yeah, absolutely. And that's what I tell a lot of my clients. Like, if you've got high insulin floating around, like you physically can't get into fat burning mode if that was one of your goals. And they're like,
Exactly.
oh, start to spark off and listen. I'm like, and that's why we don't eat 24/7, snack all day on whatever life is presenting us with, because there's lots of yummy options out there. And I think what surprises a lot of people is that sugar is inflammatory. I know this to be true for myself. I know if I've like fallen off my good eating habits and eating more sugar than normal, because my body will respond accordingly. So I think that's yeah, a really important point that you made, that it is inflammatory to the body. You've also talked about hidden metabolic shifts that most women aren't aware of. Can you share what some of these are and how they quietly work against us?
Yes, absolutely. We generally, most people are more insulin sensitive when we're younger.
Hmm.
Of course, the system works better in a lot of ways, but estrogen is really important to keep our bodies insulin sensitive. And as we lose the effects of estrogen, especially as we enter perimenopause and menopause, and that's a different time frame for many women. You know, some women enter perimenopause in their 30s and they certainly haven't stopped having periods, but when we enter perimenopause, that period of 6 months for some women, 10 years for other women, where the estrogen goes on a roller coaster and starts going up and down, up and down. You can have during those periods where you don't have as much protection from estrogen, we can become more insulin resistant and the body just has trouble listening to that insulin signal. And just like you said, we start to store fat and store our food as fat and become less efficient, at using food as fuel. And fuel, I think, that's the foundation of our health, of how we fuel our body. And the other hormones are very important and they do great things. But I think when I work with patients, usually we work on metabolic health first. And that doesn't mean that you have to be perfect and you can never have a treat again and that you have to, join the monastery and only eat kale for the rest of your life. But I think that there are some reasonable ways that we can tune up our metabolism and just get to feeling better
Yeah.
um, while making good choices.
Absolutely. And we the sort of concept we use in Ayurveda is called Agni, the Agni of our cells, which is like the metabolism of our cells. We often think metabolism just being how we process food, but when we can optimize our metabolism, we're optimizing the metabolism of our thoughts and the processes, other
Mm,
processes in our body, how we can actually use the energy more effectively without us being tired at the end of the day, and those type of things. It really is like a metabolic process is more than just how quickly we can burn through our food. So, with all of this amazing information you've given us, why do so many women struggle in midlife, even when they're doing all the right things? Like, what common mistakes are you seeing in your
yes.
practice?
Yes, I think in some ways we have been fed the wrong information for a long time. There's a lot of things working against women. So yes, we enter this period of perimenopause and we lose the protection of estrogen and progesterone. And progesterone is also a hormone that's pretty anti-inflammatory. So when we tend to lose progesterone before we lose estrogen, progesterone gradually tapers off while estrogen goes on that wild ride where you don't know where you are half of the time. Am I too high? Am I too low? But as we lose those protective hormones, we're becoming more insulin resistant. And a lot of women, especially in prior generations, have been taught the diet culture has been so prevalent.
Hmm.
There's throughout the world, we know that a growing number of people have become overweight over the last 30, 50 years. And rather than as doctors and as a society, rather than say, what's going on here? Why is this happening to so many people? I think we made a big mistake as doctors of saying, well, you should eat less and move more, of really putting that on people where it's like, do we really think all of society has all of a sudden become lazy and stopped trying? So I think there's been a lot of misleading diet culture that has been focused on restriction. And
Yeah.
especially as women, we are taught to make ourselves smaller, always smaller, thinner, smaller. I think subconsciously, and I hope that this is changing, but that's been the prevalent message over the past 20, 30 years is eat less, run. So we have all these cardio queens, women who are doing a lot of cardio and they're following and when they see that weight coming on and that insulin resistance starts happening, a lot of women that I work with have really started eating so much less. They've started restricting so much more and perhaps are on an exercise regimen that's so demanding that now their cortisol is out of control. They're not nourishing their bodies. And one of the hardest things I have to do is convince women that we need to actually eat more. We have to
Yeah.
nourish our bodies. So when I talk about this, I really like to reframe this whole concept as we're going to think about nourishing ourselves. We want to build ourselves up. Let's think about how we can build ourselves to be the boldest and baddest versions of ourselves in every phase of life rather than this restrictive culture that has put a wrench in a lot of our metabolisms.
Yeah, love that. And I think I was just having these thoughts like it is so interesting the time that we're in because the women that are entering sort of that perimenopausal phase, the women going into their 40s, like myself, who's in her 40s,
Hmm.
we grew up in, the 80s, 90s, where that thin culture was so dominant in our lives. It was like that hustle hard culture, the what do you call them? The Victoria's Secrets
Yes.
catwalk models that were like stick figures. And that was like
Hmm.
what we were looking up to. And, you mentioned cardio queen and that was such a thing. It was like cardio queen till the end, like you were through and through cardio queens. And it is hard to break out of that patterning because it was such a, integral time growing up in those
Hmm.
like the 80s, 90s, where it was sort of in our face all of our time, that heroin chic sort of look. I,
Yeah.
I mean, I even wrote about that in my book, my Ayurveda and the Alchemy of Her, how this phase of perimenopausal women coming through are the ones
Hmm.
that, were really taught that. So yeah, I find that extremely interesting times now. You also focus on performance medicine. So
Hmm.
what does that look like for women aged between, say, 35 to 65? Is it just for athletes or can anyone sort of benefit from this performance medicine?
Yeah, that's a great question. And for me, performance medicine is very inclusive.
Hmm.
So athletes are certainly people who benefit and who sort of gravitate to this sort of thing. But I work with a lot of women who have actually achieved a lot in their careers, achieved a lot in their lives, and now they want to live in the bodies that can really enjoy that. They want to have the energy to spend time with their friends, spend time with family, to do their hobbies and to reap the rewards of perhaps long careers. And so performance medicine is really for me about what matters to you. How can we make your life, your quality of life as high as it can be? How can we make your life so abundant that you can't even stand it? And I think those things are different for different women, but what we usually focus on, and body composition is a big part of that. And I think we also try to deny that in some ways. I see a lot of women and they come in and they're like, just so you know, I don't actually care about how I look. I just want to be healthy. And it's like, okay, but you also get to feel strong and, like yourself in the mirror, and that's okay.
Think
And
there's anything wrong with caring about how you look either. Like,
right.
you know, not self-obsessed like, in the 80s and 90s as we spoke about, like from a healthy way. But I think, yeah, it can be healthy to take pride in how you show up in the world.
Yes, definitely. We work a lot with, when it comes to performance medicine, we work with how's your energy throughout the day? How much energy do you have? How do you sleep? Do you get restful sleep? We work a lot with brain health, brain fog, concentration. As we enter perimenopause, we tend to deal with more anxiety. So progesterone is also a calming hormone. And as we lose protection from that, we tend to have less resilience to stress. So maybe it's not clinical anxiety, but a lot of women tell me that things that used to feel like no big deal all of a sudden have them rattled, where they feel like, and then they feel like there's something wrong with them. Like, why can't I handle this? This used to be nothing for me, and now it's a big deal. So there's usually one area that's more prominent for women. Some feel like, gosh, I really enjoy this type of workout, but I can't get through it like I used to. And I just don't get that, that healthy feeling afterwards. And I don't have the energy for that. Sometimes it's sleep, sometimes it's brain health, sometimes it's anxiety, sometimes it's sexual symptoms. Libido can really drop off, and our ability to have orgasms drops off, and vaginal dryness, all those things happen most of the time. Women, once you open that door and start asking them, usually they're like, yes, I want to work on this. Most of the time, it's not the first thing they'll tell you about. But we work on all the things that
Yeah.
make life worth living.
Yeah, I guess like, sometimes there can be so many different little things. You're like, got to narrow it down to what
Hmm.
what will feel the most successful for you to really to work on in this moment, and then all other things usually fall into place if you're really working from that sort of metabolic hormonal perspective. Anyway, what I did want to ask you about is the role of peptides. And I've not really spoken much about this on the podcast. So I'd love to sort of dive into the role of peptides. I know that you, use this in your practice. Also, obviously, nutrition and lifestyle medicine and the role they play in restoring hormonal balance and metabolic function.
Yeah, great questions. So, usually when I work with women, we work on a foundation of metabolic health first. So, that has to be in place. I think for me, if we sort of try to put the cart before the horse and work on hormones or peptides, it generally doesn't work. So we need some degree of metabolic health first. And then when we have your body using, which doesn't mean you lose all the weight you ever wanted or, you're in perfect shape, just we get your body using food as fuel appropriately. And then we can start looking at hormone health. So usually thyroid health, adrenal health, and estrogen, progesterone, testosterone. So those are the big things, and we try to then balance the hormones, whether we do it naturally through food, through exercise, or whether we use bioidentical hormones or herbs. Usually we try to get those balanced. And then we kind of see what else might be left over. And for some women, particularly women who have had periods of high stress, periods of burnout, their labs might look normal, everything might look perfect on paper, but there's been so much wear and tear that we still need a little more help. And that's where peptides usually come in. So, peptides are chemical messengers that are naturally produced in our bodies. We make thousands and thousands of peptides. Insulin is actually a peptide. That's one that's commonly known, but all that means is that it's a small chain of amino acids that signal some sort of process to happen in the body. So when we take a peptide, it's sort of like tipping over the first domino in a row of dominoes. So we're enhancing some process that has broken down, whether that's due to high stress or due to environmental exposures to toxin or trauma or your genetics. There's often pathways that even though we've optimized your metabolic health and your hormone health, something is still going on. And a big thing is inflammation as well. Inflammation can be a big part of this. So each peptide has a very specific role. And I can talk about a few specific ones and how they work, what they can do for
Yeah, that's
women.
amazing. Yeah, I'm super interested in this.
Yes, yes. So I think the one that's probably most popular is something called BPC 157, and that stands for Body Protective Compound. And it's made naturally in our guts, and it was isolated many years ago by scientists looking at healing stomach ulcers. So, we have this protective layer around our stomach so that the acid in there doesn't burn everything up. And the scientists found that there's a lot of this BPC compound in there, and that prevents our stomach lining from breaking down and forming ulcers. So they isolated this and first started doing animal trials and found that giving this to animals who were injured healed the injury very, very quickly. So particularly in tendon injuries or musculoskeletal injuries, these injuries healed much quicker and there was less inflammation. So this is a very safe peptide, and we use this for people who have too much inflammation, often because of environmental exposures or sometimes because of a chronic infection or a virus. And again, we've maybe optimized everything else. We've looked at gut health, but there's still this inflammation or autoimmunity. The BPC, the body protective compound, can be that first domino that sets off anti-inflammatory pathways while also doing a lot of healing. So we use it in injuries. We use it for people who are having trouble recovering from workouts. Sometimes people feel like, I used to really enjoy this workout, but now I just feel drained halfway through and I feel worse afterwards. My energy is low. And the body protective compound helps heal those muscles more quickly and allow people to maintain the level of activity that brings them joy. So that's been really powerful. It also can help with stomach ulcers and acid reflux. So it sort of finds injured tissue and can send the right cells to that area.
So
And
is it
it's been
taken in oral form? Is it an oral supplement?
so there's an oral form and an injectable form. The oral form tends to work better locally in the gut. So if people are having trouble with acid reflux, it tightens the lower esophageal sphincter, which is the valve that should be tight for the acid not to come back up. And it can also heal the lining of the stomach for anyone dealing with stomach ulcers. The injectable form works better for musculoskeletal aches and pains, for people, especially for people who have tendon injuries. A lot of athletes use it to return to play after an injury and sort of enhance that healing.
Interesting.
Yeah.
And so I just want to shift the conversation slightly to cortisol. So we've been talking a lot about hormones and wondering if you can explain the link between cortisol and stubborn belly fat. Like, why is stress such a major player in hormonal health?
Yeah, yeah, and that's another really interesting avenue. And cortisol is our main stress hormone, and it's produced by our adrenal glands, which are little guys sitting on top of our kidneys. And cortisol is really important. Having too little cortisol will make us feel super tired. Having too much cortisol gives a lot of us that wired but tired feeling, or a lot of times when we want to go to sleep at night. We're so tired from the day, but you have that wired but tired feeling like something in your body won't let go. That tends to be cortisol. So, and a lot of people during high stress periods, whether it's with child rearing or during a career, will have high levels of cortisol, very high levels. But then eventually the adrenal glands downregulate and it's sort of like the boy who cried wolf. You know, we're supposed to just put out a little bit of cortisol when the lion's chasing us, and the adrenal glands get upset if, we're acting like the lion is chasing us 24/7, and they start saying, we're just not going to do this anymore. We've overproduced for all this time. Now we're just going to have like a underproduction of this. So cortisol causes us to be insulin resistant and also to store more of that adipose tissue, that fat around our belly, around our middle. And it doesn't let us to tap into fat stores. And it keeps us in that emergency mode where basically you never get to rest and digest and actually fully metabolize your food and use it as fuel, but you're always kind of prepared for an emergency and for a rainy day. Increases your blood sugar because, evolutionarily, that high cortisol period meant that we have to run, we have to motivate, like we really have to do something to get out of whatever this emergency is. So we get higher blood sugar so that we can run. But most of our cortisol surges now are not the kind that require running. Our bodies are just still wired in order to do that. Our mind runs, but our body does not. And we get those blood sugar surges, that insulin resistance, and insulin resistance often leads to that belly fat that forms around the core. But I actually often see women, and we do cortisol testing, and they're now in a stage of their lives where it's very low, where they can no longer get, and most of the time, that's adrenal fatigue. These are women who don't have the energy to exercise, don't have drive. And I think this can often be confused for depression. And
Yeah, so
I've
true.
worked with women who were put on Prozac and then told me, that just didn't sound right. I don't think that's what it is. It feels like something is off, but this isn't, I don't actually think I'm depressed. And we address some of these things, and they certainly don't need antidepressants. We just need to rewire how they're using some of their hormones and teach the body that it's safe to produce a normal amount of cortisol to keep us awake, but not overstimulated.
Yeah, absolutely. And we know like with cortisol, like and the adrenals sort of nourishing those, we can do that through a lot of it does take a lot of lifestyle implementations to reduce the stress and to really have a look at where we're putting boundaries in place. And there's some beautiful adaptogenic herbs that can support our adrenals and cortisol balance as well. Well, when we look at our sex hormones, so we do have that sort of natural decline in estrogen and progesterone as we get older as women, move from that perimenopausal phase to that menopausal phase, is you spoke about bioidentical hormones. So is hormonal therapy sort of the only way to balance these hormones from your perspective in this stage of decline in these hormones? Or are there some fundamental sort of shifts that women can make without the medication? What's your sort of perspective on that?
Yeah, I think that the lifestyle factors have a huge impact on how we go through that transition. And I think this is sort of a nuanced question and answer. I think that now we're learning that there are some protective benefits from bioidentical hormones for brain health, for heart health, and for longevity. And sometimes I think it is worth taking the hormones for that particular reason. There was some recent studies that showed that although women live longer than men, our quality of life during our last 20 years is so much lower. Our quality of life scores, and women tend to decline faster than men. And again, we were evolutionarily, for a large part of human history, we were born to reproduce, and after we were done, we died. And so both hormones and peptides, our body doesn't, uh, our body is very efficient, and it tries not to waste energy because this is our last few years of being alive. Now with modern medicine, that is certainly not the case. So aside from that, where I do think that there are some health benefits, especially for the brain and protecting us from cognitive decline, protecting bone strength, aside from that, I think that the lifestyle factors really influence how women will go through this perimenopause period. So we touched on cortisol. We talked about stress, and stress is inevitable. We know that if you're alive, you're going to encounter stress. But progesterone in particular, some of the raw ingredients to make progesterone are the same ones to make cortisol. So when we are pushing and the gas is all the way on all the time, we don't have the raw ingredients to make progesterone, which is the calming hormone, and we lose more of that protection. So I think, you talk about this beautifully. I think finding ways to intentionally engage our parasympathetic nervous system, so that's that rest and restore, rest and digest. And in our modern lives, I think then many women feel powerless over the stress in their lives. The stress might be, and there may be variables that you don't have much control over. But I think we underestimate how much power setting aside some time to purposely engage that parasympathetic nervous system. And there's so many ways to do it. For some women like myself, I love yoga and meditation, and it does a lot for me. I know that's not the case for everyone. Some women will love an Epsom salt bath and take 20 minutes to do that for yourself, or do an adult coloring book, or walk in nature, or really making time for connection with others and joy. I think that all those are such powerful tools, and I think we can often underestimate how powerful those things can be while we're running around and trying to take care of everyone else and be what everyone else needs us to be. So on the stress front, I think finding ways to intentionally engage the parasympathetic nervous system can counteract a lot of that damage that the stress causes to our hormonal balance.
Absolutely. And I think another stress that a lot of women have is there is so much information out there and a lot of conflicting information. And unfortunately, a lot of people that get the information out there are the ones that have the most following on social media, but don't have any formal training. So it can be really
Yes.
confusing for a lot of women. And I guess, like, from an Ayurvedic perspective, we teach women how to really understand their own individual constitution. And that's how we can start to personalize different health strategies and plan for each woman, because not one thing is going to work for everyone. So, from your perspective, how can someone cut through the noise and build a personal health strategy for them? Like, where can they start if they're feeling a bit overwhelmed or burnt out?
Yeah. I think that starting with real basics and, and the foundations of health. And I think this is a lot of what interests me and what I've studied and what I try to apply in my practice is how can we create conditions for health? Rather than chasing some sort of, complicated diet plan or diving into complex protocols, starting with eating diet that contains the nutrients your body needs to thrive. And that can be somewhat different for each woman, but most women need more protein than they think. And we need way more plants than we think, than we usually get in order to feed all the little microbes in our gut that are controlling our well being and sending signals to our brain and controlling our happy hormones. So, usually, as a very simple rule of thumb, I tell women if you can get at 80 to 100 grams of protein and 20 grams of fiber in a day, and that fiber comes from fruits and vegetables, you're probably on the right track. And keep it as simple as you can. Find the foods that you like that nourish your body
Yeah.
and movement. Movement, of course, is really important. And again, we do have people telling you that you have to move like this and you can, and yes, lifting heavy is great and having these protocols is awesome, but do movement that gives your body joy. The best movement for you are the kind you enjoy and that you'll do on a regular basis. So again, just like you said, this is a very personal journey. And I think a lot of us are looking for guidance, but trying to keep it simple and finding something that brings your body joy, that makes you feel good, that gives you just enough challenge where your body's growing and changing, but not so much that your energy is tanking or that you're really sore and you don't feel good and you're hating every second of it. So sleep and stress. We talked a little bit about stress, purposely engaging that parasympathetic nervous system. And sleep is also, we spend so much time talking about habits of how to get a healthy diet, how to exercise, but sleep is also a habit. And there are so many behavioral tools and sort of habit shifts that we have control over where we can get better, more restorative sleep, which will affect metabolic health and weight and hormone health. So just making sure that your room is all dark. Of course, no screens before bed. Maybe doing a wind down activity before going to sleep. Trying to have a somewhat regular bedtime. Trying to give your body enough time to be able to get that deep sleep and that REM sleep can be really powerful. So I think just trying to keep it simple and finding what works for you. You have to be, in the end, there's a lot of advice out there, but you are your own experiment. You're the only one who lives in this body and you may try one thing and it may totally resonate with you and be great, make you feel super healthy, but it may not.
Yeah.
And that's okay.
I think, yeah, as women, we do tend to overcomplicate a lot of things in our life. So if we can just keep it really simple and we eat well, we move well, and we sleep well, then we will ultimately be well. So keeping it very basic. I would love to just end with one more question, and that is, what's one belief or myth about female metabolism or hormones that you'd love to see disappear?
Yeah. I think we really demonize carbohydrates, and there's been this shift towards a lot of people feeling like we cannot have any carbs at all in any time and all this guilt. And I think that finding more balance where we don't have to completely do away with an entire food group. Exercise carbohydrates are great fuel for exercise. So the timing of carbohydrate intake is important. And it's this kind of the quickest source of fuel. And there are times when it's appropriate for our body. We should not have a diet that's completely based on carbs. But I think that being terrified of carbs and never touching them is also not necessarily healthy, including all the macronutrients in our diets can be healthy. So I think just staying away from extreme diets, extreme advice, and trying to find more of that middle path that actually works for your body. I think it's hard sometimes, especially as women, to really tune into ourselves um, and figure out what works. And I think getting the advice and the guidance and the treatment that we need, but also just honoring our own responses to things and getting to know our own bodies and trusting that we'll get some supportive messages from our bodies.
Beautiful. Well, thank you so much for this incredible, insightful, and empowering conversation. I really enjoyed having you on the podcast. And
Thank
so,
you so
ladies, if
much.
this is resonating with you and you're ready to stop guessing and start strategizing your health, then please check out Dr. Gaia's work. Where can they check that out? Where can our listeners find you?
Yeah. So the best place is to go to our website, which is the gajerpractice.com. And it's spelled Gajer. It is a Polish name. So the J is pronounced like a Y. And there's an option there to book a free introductory call. And someone from my office, we can always have a chat, and we provide some health coaching worldwide where we can work with you either alongside your doctor to try to help you get to your goals.
Beautiful. Thank you so much. And
Yeah.
to all our listeners, if you are looking to deepen your knowledge of hormone balance and holistic vitality in the meantime, then make sure that you explore the Ayurveda Alchemist Academy or grab a copy of my book, Ayurveda and the Alchemy of Her. I'll make sure that all of those links are in the show notes along with Dr. Alexandra's as well. Thank you so much.
Thank you. Thank you so much.